We have a 25-year-old patient here laying in the hospital bed with obvious signs of trauma. Ma'am, how are you doing today? Clearly distressed at this point. She's not able to share with us how she's feeling, but we see obvious signs of injury. What we're going to want to do at this point is take an obvious appearance of all injuries. Where are they at? Take note of all of these things. How is the patient appearing in bed, as well as what we're going to get into next, checking for ABCs.
Okay.
Good. Okay, with checking for ABCs, what we're going to be looking for is obvious signs of life. ABCs stand for airway, breathing, and circulation. So airway, we need to make sure that they have an open and patent airway. So what we can listen for is movement of air. We definitely hear that at this point. We're going to check for breathing, so we're going to watch for chest rise. We can feel for this if there is weak breaths at this point. She is having a very strong breath with good chest rise, so we're good with that aspect. And the last part is checking for circulation. So we're going to want to check multiple spots for circulation, specifically due to the amount of injuries that we have. One of the first ones we're always going to check for is in the wrist on the radial side. This is the thumb side. We're checking for pulse. What we feel is a strong pulse on the right arm over here. We can continue on down the line. We can check for distal pulses of this individual. If we have a weak pulse in the distal area, we can check up a little bit higher, usually in the femoral area. Again, have good strong pulses on the right side. No obvious signs of injury in this area over here. We can also check for pulses in the neck, make sure that they have a strong pulse. We do also feel a strong pulse over here. Now, because of the obvious signs of trauma on the left side of the body and the arm, we're definitely going to want to check this pulse. What we'll notice is a weak and thready pulse over here. So obvious signs of trauma leading to loss of perfusion in distal areas. Finally, finish by checking the pulse. We can either check behind the ankle or on top of the foot in what we call the posterior tibial artery or the dorsalis pedis artery.
Oh, I can feel it. Okay.
So after checking manually the airway, breathing, respirations, or circulation, we're going to check the monitor and compare our results. So what I had felt with the actual manual pulse taking was about 100 beats per minute, and what we see on the heart rate monitor is the same. What we haven't checked is the blood pressure, but what we have is a manual blood pressure being taken by the machine here. The blood pressure itself is somewhat elevated. We'll take note of that. Respiration rates, we can look, listen, and feel for breathing, and we see that they're right around the same number of 15 to 16 respirations. We also have monitoring for end-tidal CO2 and SpO2. They are getting good oxygenation to their body with 99% SpO2 at this point. Okay, so what we're going to check for now is initial signs of injury. We're going to look at the wounds that this individual has. We're going to take note of where they're at and how they appear. So we see a very large open wound on the abdomen, right lower side. So take note of location in the abdomen region. What type of injury is this? Is there any active bleeding that we need to be aware of to take care of? We're always going to want to take care of active bleeding at this point and then assess the wounds after that. We also see a very large open wound in the left upper brachial region. We're going to take note of everything that we see inside of the wound. How large is the wound? Where is it located? How close to each of the structures. Use descriptive terms. So when you go back through your notes, you know exactly where this wound took place. Next, what we're going to do is look at the actual tissues that are involved here. At this point in your class, what you're going over is tissue evaluation. So what do we see as part of the injured areas? We see that the top covering, the skin area, has been opened up and what appears to be a laceration. The epithelial tissue was definitely impacted at this point. How much of the epithelial tissue is actually involved is what you guys are going to be evaluating. Additionally, what you see underneath are additional layers of tissues. We see connective tissue all the way down to muscle at this point in the abdomen. So what things are you guys concerned of with this type of injury? Where are we in the body? What type of structures do we find in this area? Are we worried about anything deeper to what we actually see? Perhaps there's more trauma that we don't see and might need to request additional diagnosis. On the arm here, what we notice, again, epithelial is open up all the way through the connective tissue, and what we actually see inside of here is bone poking through. So what things are we concerned of with this area? What we're going to want to look for are obvious signs of trauma around the tissue as well as below the area. Perhaps we lost some nerves or blood flow. We'd already noted that there's weak and thready pulse down here, so most likely impact to blood vessels. We can also check for sensations. Can you feel this, ma'am? Can you feel over here? We check on multiple spots in the arm, and whether or not they feel that is going to determine how much loss they have in the actual injured area. Right, so after evaluating these wounds, what are we actually going to be worried about is your next thought process. So which of these wounds do you suspect is going to have the most impact on this individual? Which one is going to require the most repair? Are any of these wounds going to have a scar associated with them after repair? Some of the things you want to consider after treatment of these things, after we close up the wounds surgically, what is the body going to go through in terms of the healing process? That's where we're going to leave you. Hi, welcome. You have a 34-year-old patient presenting to the emergency department with a potential 25% body burn. We see injuries of partial thickness all the way to full thickness burns across the face, chest, arm, and lower limb. This individual is exhibiting significant amount of pain with possible signs of fluid loss. We're going to be analyzing and evaluating this individual's burns as well as tissue damage in this simulation. So what I want you guys to do is take an overall appearance of this individual. Where do you see the injuries, the obvious signs of injuries? Next thing you're going to be looking for obvious signs of life. Is this individual still breathing? Are they have a patent airway? And what we're going to do is check for circulation, much like we did with our ABCs. So on this individual, we're going to check on their pulses. We usually check on the radial side. We're going to check multiple areas of the body to make sure everything is perfusing properly. Check on the top, check on the inside. We have good, strong pulses in all areas here. We can check again on the left side. We feel there is weaker pulse on this side because we're comparing the two sides. Again, if we feel it's weak in this area, let's check in a upper area. We can check on the inner thigh and we see that it is strong here but weaker down here. We'll get to why that is in a moment. Checking on the opposite side, we're going to check for pulse. We notice that the pulse is strong over there. And again, we can check for pulses in the neck. We see that there is possible impact to the neck area with this injury. So you always want to check for any areas for possible perfusion loss. Additionally, what we're going to be looking for are signs of breathing. So we're going to look, listen, and feel for chest rise. This individual is breathing well. We can see and hear that the airway is open. They are taking breaths. We're going to use this information to compare it to our monitor. And what we see, our heart rate is right around 100 beats per minute. Blood pressure is elevated with respiration rates right around 14 to 15, which is about what we had measured in our manual taking of pulse and breathing. Additionally, what we see are the end-tidal CO2 and SpO2. They are getting good oxygenation to their body with about 98% on the SpO2. Next, what we're going to be looking at is the obvious signs of injury. So what I want you guys to note is, where do we see injuries? describe how the injury is moving across. We're going to try and paint a full picture so when you go back to write your note, you know exactly where this was. Imagine if you had to take this notes and use this to write your note, but you no longer had the patient. You need to be able to write these notes as if you were in the patient's room. So what do we notice? We see a facial scarring all the way down through the arm. It looks like there was a path of travel for this electrical wire all the way down into the arm. Make sure you note which side of the arm, which side of the chest all of these injuries are. Additionally, what we see is movement down into lower limb. We see a very large injury, most likely where the injured site started. The individual was working on electrical work, and what we probably see is this individual had the wire working up top, pulled it down across their face, and it got stuck near their leg where it caused the most damage down here. Make sure you note where in the leg this is, which leg this is. Remember, we're referring to patient's right versus patient's left. This is their left lower limb in the thigh region on the lateral side. Be sure when you're describing these wounds and where all of them are found, use the anatomical terminology. We're trying to instill in you a common language that you will use in the medical field. So everyone is speaking the same language. Everyone knows exactly where the injuries are. So with these injuries, are there any obvious things that we need to take care of at this point? We ask the patient how he is feeling and ask to pinpoint any specific areas of pain. The individual complained of arm pain as well as significant pain all through the body. Now, with this being an electrical wound, what are some things that we're going to be worried about? Well, because electricity likes to find areas of path of least resistance, it is going to travel through the body and find a way to ground itself out. So one of the things that we're going to want to do is grab this individual and check on all sides of him to make sure there are no other signs of injury. So typically we will have additional people to help lift this individual. I will assist in this. Usually we want to check, place our hands on the shoulder and the hips, rotate to make sure we don't see anything on the back side, and then rotate again from the opposite side and pull this individual over. And what we notice, there are no obvious signs of injury. The path did not travel all through the body, but something about the human body that you should be aware of is we are very good conductors of electricity. Question for you, why? So after assessing all the injuries, we're going to go through the tissue evaluation, much like we would do in a normal patient situation. We're going to look at each of the injuries and see what type of tissues we have injured. Clearly, we have a strong epithelial damage with this lower leg wound. Are there any additional tissues that we would be worried about? Are there any additional deeper structures that we should be worried about if there was an electrical damage? At this point, we do not see any need for immediate treatment. No active bleeding at this point. It appears that the wound was directly cauterized from the electrical wire. But again, we reference back to whether or not we had pulses in the distal areas, and we saw there was weaker pulse in the lower limb. So we suspect possible blood vessels being impacted in here. We can also assess for sensation in areas like around the knee, in the shin, and on the feet. Test for different sensations of these areas due to the obvious trauma up here. We can do that same workup in the upper arm, and what we'll notice is this injury was not nearly as significant, with only slight charring along the epithelial region. Again, we're still going to assess for possible deeper damages, but we have no obvious reason to suspect anything deeper. When the patient was originally brought in, we had an evaluation of how much of the body was burned at about 25%. Now, this was taken out in the field by EMS. We can do a better evaluation when the patient actually comes in. What we see is multiple burns over the body. As a rule of thumb, we have this idea called the rule of nines to help give an average amount of body that is burned. Each section of the body makes up a certain percentage. We usually see this as 9 to 18%. In the body, the head makes up about 9% of the actual body. In the chest, we make up about 18%. Each of the arms make up about 9%, and each of the legs make up 9%. So let's do a more accurate evaluation of how much of the body is actually damaged. Now, with the face, because we only have burn to the anterior portion of the face, and the head and neck make up about 9%, we can say only half of the face is burned, or half of the head is burned, so we're going to reduce that number from 9 to about 4.5%. Moving out into the chest, again, the chest makes up about 18% of the body. We only have coverage over this small area right here. As a more accurate way to measure this, we can use the patient's hand, which represents about 1% of the body, to measure this more accurately. Now, you can use your own hand as long as the hand matches up to about the same size. If you have a larger or smaller hand, you should use the patient's hand as the 1% rule. So counting 1%, we see about 1, 2, 3, and 4% of the body actually covered in this, giving us a grand total roughly 8.5 to 9%. Moving into the upper limb here, remember the upper limb is 9%. It is split into 4.5 for the upper limb, 4.5 for the lower part of the limb. And what we see is a involvement of the anterior, lateral, and somewhat posterior aspect here. So we have full involvement of the upper limb, giving us another total of 4.5%. That brings our grand total up to about 13% at this point. Moving down into the lower limb to get a good adjustment. Remember, the lower limb is worth 9%. Again, we can divide it into 4.5 and 4.5 on this side. And then again, on the back side, we have 4.5 and 4.5. The lower limb has involvement of the anterior, lateral, and posterior sides. So we give this, because it has involvement in all areas, we can count this as 4.5 on the front, 4.5 on the back, giving us a total of 9%, bringing our grand total to about 22 to 23%. Fairly accurate from the EMS.